Hello, everyone. Good morning. Good morning, good afternoon, good evening, depending on where in the world you're tuning in from. So while we wait for folks to join in, we'd love to hear where you're joining in from. So please send a message in the chat, like where you're from, like maybe your school. Hello, Mamoon. We have Mamoon from Bangladesh. Welcome. And Peter from Lagos, Nigeria. Omu from Liberia. Hi and welcome. And Rezki from Indonesia. Hey, welcome to the webinar. And we have Jiang Yang from Shanghai, China. So welcome everyone. So once again, good morning everyone, good afternoon, good evening, depending on where you're tuning in from. My name is Nindu. I use he, him pronouns, and I'm the student engagement coordinator at ISSS. And I'm also an international student. I'm from Sri Lanka. So thanks so much everyone for joining us today. Welcome to the webinar on health and wellness. We are so excited to spend this time with you and hope all of you will find this session helpful. And again, in the meantime, feel free to type in the chat where in the world you're joining us from. And just a quick note before we get started, I want to let you know that this webinar will be recorded. And if you prefer not to be included in the recording, especially your video, please feel free to turn off your camera at any time. So with that, I will now pass to Liam to walk through the Q&A function of today's webinar. Liam.
Thank you so much, Nindu. Welcome, everybody. I just want to mention and talk a little bit about the Q&A function that we're going to be using during this webinar. If you have any questions, refer to that Q&A option. You should be able to find it in the bottom right of your Zoom window. If you don't find it, try clicking the three dots icon, and then you should be able to find it there. There's also a chat function as seen in the screenshot down on the left. Please note that we will not be answering questions over the chat. So to ensure that your question is addressed, please make sure to use the Q&A function only. We're very excited to spend some time with you, and I hope that you guys find today's session helpful. And now we'll go with Doris to speak about the upcoming GGE events.
Thank you, Liam. Hi, everyone. My name is Doris Lee, and I use she, her pronoun. I am a senior global golfer experiences leader at ISSS, or ISSS. So, welcome to attend our session. Our panelists today will share a lot of helpful information during today's session. So, if you don't have a chance to write down all the information, don't worry. This event will be recorded just as we mentioned, and it will be uploaded to our website. So you can watch it again and again after the event, as many times as you want. You can also find our recordings of our previous GG sessions on the website, which we will share the link soon. And GG includes many different helpful sessions, just like this one. So we would love to see you again in our future events. You can see all of our upcoming events shown on this slide, and we have also marked that each event will be held virtually or in person. So for the global tea time at Centennial Hall's lobby, we will have some snacks and drinks, some games, and other fun activities with our student leaders, which you might see them today. And we will try to help you to relax and make some friends before our busy semester kicks off. So our next webinar for all of our students is on August 19, 8 to 9:30 a.m. Central Time, which is Meet Your College Fellows. So if you're interested in the session to get connected with folks in your program, in your college, please make sure to register. And we will share the registration link for the event in the chat now. So now I'll pass it to Beth Essency, the Associate Director of Student Engagement and Intercultural Initiatives in ICSS, to do the welcome remarks.
Well, hello, everyone. It's so good to have all of you here today. Again, my name is Beth Eisensee. I use she, her pronouns. And as Doris shared, I'm Associate Director at International Student and Scholar Services. We are so glad you're joining us for this Global Gopher Experiences session today. If this is your first time joining us, I would like to be the first one to officially welcome you to the University of Minnesota as a Global Gopher. We call you a Global Gopher as Goldie Gopher is our beloved and award-winning University of Minnesota Twin Cities mascot. And now you are part of the Gopher family, and this family extends all around the world. I just want to, as you probably know well at this time, International Student and Scholar Services is the office on campus dedicated to holistically serving the university's international community, and that means you. So our team of over 30 staff members are here to support you through your educational journey in collaboration with your colleges and other units across campus, such as health services. So one of the areas we specialize in is providing you immigration guidance and support. So I do want to acknowledge that on July 17th, 2026, the U.S. Department of Homeland Security published a final version of a new immigration immigration rule that will change the way F and J visa holders, which includes most of our students and most of our scholars, are admitted into the United States. But this rule will not go in effect until September 15th, 2026. So this will be after you arrive in Minnesota, but it is likely to impact your long-term planning. So you will probably be receiving messages around this new rule around, it's called duration of status, and just wanting to make sure you know that this rule has changed, and that is really important information to pay attention to. So you can learn about this new rule and all our other immigration updates on our website, and we'll continually update our web pages so that you can stay up to date. So we're going to turn now to the topic of our webinar, which is health and wellness. And we know that from experience that June, July, and especially early August is when students are asking questions around immunizations. How do I transfer my medical prescriptions? When do I see a doctor? How much will it cost? How do I remind myself to keep focusing on my well-being while being a student? I have to say my own daughter is studying in Seoul, South Korea this semester, and she leaves at the end of August. And we have spent the last 2 months trying to get all of her health needs prepared and exploring how to get care where she's at. And it is really important because we want you to be focused on your academics. And if your health and your wellness is impacting you, we want to be, as a university, we know it's very important to support you in that as well. So I'm going to now pass it on to our amazing experts and student leaders to share more about this topic. Doris?
Yes. Thank you, Beth, so much for sharing all the info. And now I'll go back to introduce our presenters today. So we know that moving to a new country, is definitely really overwhelming. And then you have to navigate the healthcare more overwhelming, right? So I myself is an international student from Taiwan, and I know how it feels like, but we want you to know that you are not alone. So we have many professional staff today and our student leaders joining us online. So we are here to help you to navigate the US healthcare system. So today we are joined by several campus partners from Housing and Residential Life, Boynton Health, Office of Student Health Benefits, and Blue Cross Blue Shield of Minnesota to help you support through this process. So they are all here to provide you all kinds of valuable information and answer your questions. So we are so lucky to have several ISS staff members with us today, which they are able to help you answer questions related to ISS requirements, your Y-20 or visa, and other immigration related topics. And finally, we have our amazing student leaders here too. And we have already heard some of us speaking, presenting earlier. So we are all excited to share our own experiences with you. And we hope that hearing our stories or experiences can help you to feel more connected, more supported, and confident that you can thrive at here too. So now I like to hand it over to Katie from Housing and Residential Life to get us started.
Thank you, Doris. Hello, everyone. My name is Katie Olson Williams. I use she, her pronouns, and I am an associate director in Housing and Residential Life here at the university. Today, I'm going to share some important information about on-campus housing. So, Housing and Residential Life provides housing to roughly 7,000 students in 11 buildings across campus. We do provide opportunities for students to meet others. We have staff on site as a resource to you. In addition, we have almost 40 unique living and learning communities where students live in a community with others that share the same academic goals or personal interests. Next slide, please. So for fall housing, if you are living on campus or not, we actually provide early arrival housing for international students. This began July 26th, and we do offer this opportunity through August 28th. The housing will be located in Centennial Hall. However, it is only available for students enrolled at the university, and unfortunately, we cannot accommodate families. Move out from early arrival housing is Friday, August 28th by 4:30 p.m. For those who are living on campus with us this fall, we will provide transportation assistance if you need to your fall building on that afternoon. And you will be able to transition directly from the early arrival housing into your fall housing assignment. So there is consistent housing provided for you throughout that duration. During this time, 17th Avenue Dining Center will be open most of this month. However, it is very important to check the dining webpage for hours of operation, as there are some dates that may not be available. And it's very important to remember that dining is not included in the early arrival housing cost. If you arrive early and you are interested in dining, you may purchase dining dollars, which is a declining balance on your card, to use in both the dining center or other retail locations on campus. If you are living with us this fall, move-in will begin in the apartments, so Udolph and Keeler Halls, on August 15th, and September 1st, which is a Tuesday this year, for our first year traditional residence halls and Wilkins Hall, which is another apartment building. Assignments were emailed last week and move-in information was sent yesterday. So you should go online to the housing portal to make your move-in appointment prior to arriving so that we can make sure that you have a time slated for that. And again, if you need to come prior to September 1st and you're in a traditional residence hall or Wilkins, please do complete that early arrival request, which is also located on our portal. If you have a roommate, you can learn more about connecting with your roommate on our website. And if you have not yet found fall housing, we encourage you to utilize our off-campus housing listing service, or still there is time to apply for housing on campus with us. There are a number of links shared on the screen that will be sent to you as well. So please do utilize those resources. All right, next slide. So As the focus of this webinar today is around your health and safety, and that is also very important to us. So we do have some important websites for you again to utilize, bookmark for your as a resource for future. But as a student, it is important to take care of your well-being. There are several opportunities in your hall to connect with others, including jobs within housing and residential life. So you may work where you live, or create and or participate in one of many of our groups. You can also create your own. Check out our website for more information and truly utilize the staff that are available as a resource to you in each hall community. As you know, we all play an important role in our community. If you experience or witness a bias incident where you feel discriminated against, please report it as soon as possible to your community advisor or submit a report to the Bias Response and Referral Network. This way, we can help provide support and appropriate follow-up. You can learn more information at the Bias Response website. I will now pass the presentation to Gracie to talk about Boynton Health Services.
Hi, thanks, Katie. Hi, I'm Gracie. I'm here with Boynton Health, the on-campus healthcare clinic for students. Boynton Health is a comprehensive college health service offering nearly all of the healthcare you will need while here at the university. Next slide. Thank you. Boynton Health is dedicated to empowering students to take control of your health. With over 100 years of experience caring for students, we understand that navigating a new healthcare system can be challenging and confusing. That's why we're committed to making the process as smooth and accessible as possible and supporting you every step of the way. Next slide. Like I said, Boynton Health is a comprehensive college health service where you can receive almost all of the care that you'll need while here at the university. We offer primary care, eye care, mental health, and pharmacy services. Additionally, we have several specialized clinics such as nutrition, physical therapy, gynecology, gender care, vaccinations, travel clinics, and also have a quick clinic and urgent care. All of these clinics are located conveniently in one building right on campus with care teams who work together. Next slide. The East Bank, Minneapolis location is our main clinic and offers all of the services I just mentioned. We also have a smaller St. Paul clinic, which offers primary care, mental health, physical therapy, nutrition, and Go for Quick clinic services. Our main clinic is on East Bank and is open Monday through Friday during general business hours. If you need help outside of our general business hours, we have after-hours care information on our website and have a 24/7 nurse line available. Additionally, you can receive mental health services on West Bank and physical therapy visits at the rec center. Next slide. The university does have an immunization requirement. All students born after 1956 are required to have the following immunizations: diphtheria, tetanus, and measles, mumps, rubella, which are distributed as a single MMR vaccination. You need to locate the form on Boynton's website to self-report the dates that you received these immunizations. Once that form has been completed, you've satisfied the requirement. If you still need the required vaccinations or would like any of the ones we recommend, they can be taken care of at Boynton Health as well. Next slide. We offer 2 quick care options to help you feel better as quickly as possible if you aren't feeling well. We have same-day appointments for Go for Quick Clinic, and they can be made online or by phone. The Go for Quick Clinic treats symptoms like COVID-19, flu, strep, and other minor conditions. For more serious symptoms such as chest pain, high fever, injuries, or cuts, you can visit urgent care for immediate attention. Both services are available during general business hours. The University of Minnesota has options for dental care on campus. Automatically included in the Student Health Benefit Plan is preventative dental benefits administered by Delta Dental. This includes coverage for routine teeth cleaning, exams, and x-rays. And you can learn more on our website about how to access dental care at the university. Next slide. Boynton Mental Health provides a supportive, confidential environment where you can seek professional mental health help. We offer a range of services, including counseling, psychiatry, group therapy, and walk-in and urgent counseling. We also offer telehealth counseling appointments and have extended early morning and evening sessions available to best meet your scheduling needs. This support not only benefits your immediate well-being, but also plays a key role in your long-term academic and professional success. And with a wait time of just 2 weeks, you can be seen faster than most other clinics. Next slide. One of our programs regularly used by fellow students is the Nutritious You Food Pantry. Our main location is in the basement of Kauffman Memorial Union, and we are open every week during the school year with rotating locations on St. Paul and West Bank. Our food pantry offers fresh and nutritious food to any student who needs it, and last fall we distributed over 95,000 pounds of food. Next slide. Another one of our most popular and cutest programs is PAWS, which stands for Pet Away Worry and Stress. Every week, therapy dogs, cats, bunnies, and chickens hop or trot onto each of our campuses, providing animal-assisted interactions that help reduce stress and create community. This last school year, PAWS had over 11,000 visits. Next slide. Boynton Pharmacy is staffed by pharmacists and support staff who are experienced in addressing student health needs. Located conveniently at our East Bank Clinic, our pharmacy offers a wide range of products tailored to support the health and wellness of your budget. Our pharmacists take the time to educate patients about their new medications and are always available to recommend over-the-counter products. You can also visit the Boynton Pharmacy website for an easy, secure way to transfer prescriptions or to learn more about the products and services that we offer. To keep up to date with our services and programs and important campus health news, we recommend following us on our social media platforms. You can find us on Instagram, TikTok, and LinkedIn at Boynton Health. You can also find everything we discussed today, along with a full to-do list to help prepare for the semester, in our new student guide on the Boynton Health website. You can visit boynton.umn.edu to explore everything I shared today and more, including information about our services and how to schedule an appointment with us. Now we will transition to our Office of Student Health Benefits and have Greg, the Director of the Office of Student Health Benefits, explain health insurance options in more detail. Thank you so much.
Hello, everybody. As Gracie said, I'm Greg Thurston. I'm the Director of the Office of Student Health Benefits. And today I'm going to highlight health insurance requirements for the University of Minnesota, as well as some items related to health insurance in the United States that may be different from health insurance in your home country. Let's go to the next slide, please. Health insurance in the United States is complicated, even for those of us who were born here. In the few minutes that we have now, myself and Jill, who's going to speak after me, can really only give a general overview of how it works. The booklet with all the health information coverage is known as a summary plan description. That's over 100 pages long, actually, and is posted on our website. After the presentation, you'll likely have additional questions that come up in the future. The Office of Student Health Benefits contact information is provided here, and I want to assure you that we're committed to helping you with any questions you have either now or in the future. Next slide, please. First, it's important for you to realize that unless you qualify for a waiver, the University of Minnesota requires you to be on either the university's student health benefit plan or the university's graduate assistant health plan. This requirement has been in effect for over 50 years and applies to all university students, both domestic and international. It's necessary so that you can focus on academics and not worry about whether you can obtain medical services if any health issues arise. Because in the United States, having access to medical care really requires that you have health insurance. Waivers from coverage on the university plan are only granted if you're remaining in your home country for the semester or have United States employer-based health insurance, or your home country has an arrangement with the university which qualifies you for a waiver. Only the countries of Oman, Saudi Arabia, United Arab Emirates, and Kuwait have arrangements allowing waivers. If you qualify for a waiver, you should email the Office of Student Health Benefits for assistance with the process. Next slide, please. If you're a graduate fellow or graduate assistant with a qualifying appointment from the university, you should enroll in the Graduate Assistant Health Plan. The university pays a significant portion of the premium for the graduate assistants, so your contribution is low. At the beginning of the semester, your account is charged $244.86, and if your appointment is 50%, you pay no additional premium. If your appointment is less than 50%, you pay an additional amount for the semester based on your appointment level. There had been a question about before the presentation here about people paying 5% of the cost. That is correct. The $244.86 that you would pay for the semester represents 5% of the cost, with the university picking up the remaining 95%. Now, if you're going to enroll in the Graduate Assistant Health Plan, you must complete an enrollment form to enroll in that plan. To enroll, you go to our website, which is shb.umn.edu, and select Graduate Assistance, then select Enrollment. You complete and submit the form to the Office of Student Health Benefits. I do want to point out that failure to actively enroll in the Graduate Assistant Health Plan will result in the graduate assistant actually being automatically enrolled in the student health benefit plan and charged its full coverage. And you really don't want that to happen. So if you're a graduate assistant, please make sure you do the enrollment process to enroll in the Graduate Assistant Health Plan. Now, graduate students without appointments and all international undergraduate students who don't qualify for a waiver must enroll in the Student Health Benefit Plan. The cost of the Student Health Benefit Plan is $1,795 per semester and is billed to your account at the beginning of the semester. To enroll in the Student Health Benefit Plan, you simply click Enroll Me on the insurance plan communication that is sent to your MyU account. The Office of Student Health Benefits does not recommend purchasing any additional insurance, but remember, if you do decide to purchase additional health insurance, it will not allow you to waive the Student Health Benefit Plan. Next slide, please. In the United States, even with health insurance coverage, an individual may have additional out-of-pocket costs when seeking medical care. Copays are small fixed dollar amounts that are charged each time you go to the doctor or have a prescription, with the insurance plan then paying the remainder of the cost of the visit or prescription. With the Student Health Benefit Plan, when you have services outside Boynton, you may need to pay a deductible and co-insurance. Deductibles are annual dollar amounts which must be paid for services before the insurance plan begins paying for services. Co-insurance is a percentage of the claim that you must pay, with the insurance paying the remainder. However, all plans have a maximum annual out-of-pocket amount so that once you reach that amount, the insurance pays 100% for all remaining eligible claims. And when Blue Cross talks in more detail about the plan, they'll give you the copays, the deductible, and the co-insurance on the various plans. The Office of Student Health Benefits also has detailed information on its website showing the coverage levels for different types of services for each of the health plans. We can go to the next slide, please. Our plans are designed so that most individuals have very low out-of-pocket costs when obtaining medical services. Boynton Health is usually your lowest cost and most convenient place for medical care. In fact, most services provided at Boynton result in no out-of-pocket cost to those on the student health benefit plan. And then people on the graduate assistant health plan generally have just a $10 copay for services at Boynton. The medical identification card you receive from Blue Cross will have their website information, enabling you to find other available in-network providers when needed, such as if you require immediate care when Boynton is closed, or if you require a service that's not provided by Boynton. Our insurance company is called Blue Cross Blue Shield of Minnesota, and the provider network is called Aware. Aware is the biggest network that Blue Cross has. It covers hundreds of thousands of providers, so you won't have trouble finding an in-network provider, but you will need your medical identification card when obtaining services or picking up prescriptions at places other than Boynton. If using a provider other than Boynton, it's important to confirm that they're in-network before obtaining services, as you often must pay more out-of-pocket costs when utilizing providers who are not in-network. It typically takes a couple of weeks to receive your medical identification card. If you need medical services prior to receiving your card, please contact the Office of Student Health Benefits for assistance with your coverage. We're here to assist you and help answer any questions that you may have about your medical coverage. And now the next presenter is going to be Jill from Blue Cross to give you more detailed information on the plans and how to utilize your health benefits.
Thank you so much, Greg, and welcome everyone. It's a pleasure to be able to speak with you today. I'm going to review and hit on some highlights of what Greg already talked about, but we can go to the next slide. So for what we'll cover today, some health plan basics. We're going to talk about, Greg discussed this too, the importance of your provider network called Aware and staying using that network. Some different health plan options that are available to you, your prescription drug coverage, some additional health and well-being resources. So we can go to the next slide. You can keep going, the health plan basics. So first of all, your member ID card. Here's a picture of what it's going to look like. And you will receive this in the mail. And once again, if you need care before receiving this card, that is okay. You can still access, and as Greg said, you can call the center. You can also call Blue Cross Blue Shield to get your member ID number so that you would be able to see a doctor if it's outside of Boynton Health. Next one. Now, I put there Health Insurance 101 because it most definitely, some of the terminology that you're going to be hearing, it can be confusing. And I have another slide later that will give us an overall picture of kind of steps that the process goes through. But healthcare costs include a deductible, coinsurance, co-payment, and out-of-pocket maximum. So those are terms that you will hear. So a premium is the monthly payment for your health insurance. A deductible. So this is the amount you pay for each year before your plan begins to pay. So once you hit that, we call it hit your deductible, or you meet that amount, then a percent or a coinsurance of the cost will be paid for your services that you get. A co-payment, just like Greg had said before, is a small flat fee that you pay for some services. And then out-of-pocket maximum, that's the most you will have to pay for covered services each plan year. So I know that's a lot right there. So it's okay if you don't know it all right now. It takes time to get used to it, and you've got a great team around you that's willing to help as well. So next slide. So here's the step-by-step process that I was talking about earlier. It kind of gives you a visual. So first of all, you go to your doctor, you use an in-network provider or that Aware network. You're going to show them your ID card, and then you'll pay your copay. The step 2 is then your provider sends a claim to Blue Cross. So nothing that you have to worry about there. That's between the provider and Blue Cross Blue Shield. And then Blue Cross determines the amount for that visit. And keep in mind, when you use a provider in network or through the Aware network, they have contracted rates with Blue Cross. So you are going to, that's basically a better deal because they have a contracted rate with us. The 4th step after that is that Blue Cross then pays the provider what it owes. And then they're going to send you an explanation of benefits. EOB, you'll likely hear that's kind of the short abbreviation that we use. But that is going to show you what the cost was, what Blue Cross Blue Shield pay, and then if you do have a responsibility, what the responsibility that you will pay your provider. You don't pay Blue Cross Blue Shield for that because your provider is going to send you an invoice or a bill, and then you can match that against your EOB to make sure they align. So if Blue Cross Blue Shield shows, oh, you owe $20, just making up that number right now, then the provider bill should show the same thing. And then the last step of that is paying your provider. Next slide. Blue Care Advisor. This is something that I really encourage you guys to access. This is going to be an app that you can download, and it is so convenient because yes, you can, there's important links that have been shared already throughout this for your health plans, but this makes it just easy to access anything on the go. And you'll first of all have to create an account. So creating an account, you do need that member ID. So this is something most definitely you can do as soon as you get your card in the mail, or once again, if you have to access care before getting the card, you'll be given your member ID number, and so you can even access it then. But the great thing about Blue Care Advisor is that you can track everything that's happening with your plan right there on your phone. You're going to see your medical, your pharmacy spend. If you happen to forget your ID card, it's going to be on the app so you can, show it to a doctor. It's going to show you too all the providers that are in network. So it's going to be by location or by your zip code, and you would be able to find primary care physicians, specialties, which I hope you don't have to, but if you ever need an emergency room, it's going to show you where emergency rooms are. So it's a great way, once again, to just access care right at your fingertips. Next slide. And here now we're going to get into more specifics for your separate plans. So for the students, you can see there at the top, that's your specific website. Important because it shows you everything that is part of your benefits with Blue Cross, which is great to have that all in one place. But that deductible, which we talked about, is the first thing that you need to meet. For a single or an individual person, the cost is going to be $250. For a family, it's $500. That out-of-pocket maximum, so keep in mind, that's the maximum amount you would have to pay for the year, is going for an individual. If you have individual coverage, so you're just covering yourself, it's going to be $4,000. And then for a family, it's $8,000. Something really important to keep in mind that any kind of preventative care, so those would be like physicals, a well child care. So once again, I have kids. So my daughter just recently had her 15-year-old physical checkup. That is something that's covered at 100% coverage. Okay. 100% coverage, though, when you use an in-network or Aware network provider. There is going to be a 20% coinsurance after you meet the deductible if you go to an out-of-network provider. But as Greg noted earlier, Aware Network is a large network of providers. So you can use the app. You can go to that specific website, that bluecrossmn.com/UofFMN. Sorry about that, it was a mouthful. That you can go to as well. to find in-network providers. Now, a big piece here, keep in mind, if you go to Boynton Health, 100% coverage. So you don't need to be concerned about that deductible. You don't need to be concerned about that out-of-pocket maximum. So a great service there. Another really positive, convenient service is called Doctor on Demand. And there is a specific website that is going to be later on too. But Doctor on Demand is a virtual visit with a doctor. And that part too is 100% coverage after a $10 copay. So you don't have to worry about a deductible, and the only thing that will be there is a $10 copay. Hospital services, emergency room care, or ambulance, they all have the same. You're going to pay a 20% after you meet that deductible. Let's go to the next slide. I believe we get, provider network. So you can continue. And I'm kind of talking your ears off here about the provider network, but I just want to stress it one more time, that a network is a group of doctors, clinics, hospitals, and specialists, and a lot of different healthcare providers that are contracted with Blue Cross at a lower cost. So that's why it's so valuable to see a doctor that's in your Aware network, okay? In Minnesota, that's what it's called, Aware network. If you were traveling within the United States, it's still a large network, and it's a different name, National Blue Card PPO Network. And I would just say to you, the biggest words that I always think of myself since I was younger and had to deal with insurance on my own is just thinking, I want to stay in network. And I've already hit a lot on this, is just staying in network. That discounted rate, it's going to be the lowest cost that you have with doctors, pharmacies, any sort of healthcare provider. And then once again, if you go outside of your network, there's no contracted rate with Blue Cross, so the amount could be higher. And then once again, you saw too that preventative care, it's not going to be with an out-of-network doctor at 100% coverage. There's going to be some co-insurance there. You can go to the next slide. And knowing where to go. So I like this slide because it gives you an idea of all the different places that you can go to for healthcare, but then also gives you a sense of wait time and then costs as well. And once again, just keeping in mind that Boynton Health is going to be your lowest cost option. But other times we need care at different times of hours when Boynton Health might not be available. So first of all, telehealth. This is common mental health concerns that are addressed by phone, okay? Some will do virtual visits, so you'll be on video. Others, it's just phone. Not all clinics offer this, but when you schedule with a doctor, you can check to see if that is an availability. You can see your wait time there too. Short to medium, but it's a less wait time, and there's your cost as well. Online care. This is going to be your Doctor on Demand, and here's the website that I was talking about just a minute ago. Think of Doctor on Demand is for, once again, short wait time, much lower cost, and think about those times when you maybe have a cold or a cough. They can help with mental health. So if you're feeling anxious, they are 24/7. Okay, so it's 24 hours a day, 7 days a week. Another thing I can think of I've used Doctor on Demand for is for my kids when I thought, oh, this kind of looks like pink eye, I will use Doctor on Demand. It's a virtual appointment, and how convenient. Then you don't have to worry about leaving your house, spreading any germs or anything like that, and the wait time is very quick. Another type of care today is a convenience clinic. And think of this too, once again, for more of the minor illnesses. There's no appointments necessary, so that's always great. But I would encourage you to still check on times, because that does not mean they're open 7 days a week, 24 hours a day. So, I guess I do have that on there too. So it's still nights and weekends, but not like an emergency room or not like Doctor on Demand. So just be mindful of that before you go to one, to check their hours. I would encourage you to. And then of course we have office visits. This could be a preventative care. This could be for vaccines, even though once again, Boynton Health is a great resource for you. This could be for mental health therapy. Or once again, a specialist. Maybe you sprained an ankle or broke a bone, or once again, all these things that I hope you don't have to encounter, but you need to see a specialist for that. Then you would call the clinic using the Aware Network, so the in-network, and then schedule an appointment there. These are not evening appointments or weekend appointments, but your clinic will be able to tell you what their hours are and also just tell you what doctors are available. Then the other option too is urgent care. So this is going to think of this as being a little bit more than that cold feeling or possibly that pink eye. It's going to be sprains, burns. It could be for if you've got a fever that just won't go down. My niece recently had to go to urgent care because she had a high fever throughout the weekend and medicine just wasn't helping. So she had to go to the urgent care to get some help with that. For urgent care, no appointment is necessary. You can see though the cost goes up a little bit more. And the wait time also can vary depending on how busy they are. This is another time though, check their hours, you guys. It's so important for that because some urgent cares, hours a lot. They're open a lot. Where others, it maybe ends at a specific time, like 10 o'clock or so. Once again, just checking that. And then the emergency room. This is going to be your most expensive option for cost-wise, but that doesn't mean if you are having shortness of breath, chest pain, bleeding that doesn't stop, if you have thoughts of just wanting to harm yourself, if you have thoughts of wanting to harm somebody else, these are urgent things that need to be addressed right away. And ER is going to be available for you. Could be a longer wait time, but still, once again, it's a valuable service when we have something more serious. And once again, that shortness of breath, chest pain, those are just a few things, very few things that you would go to an emergency room for. Next slide. And now I talked about the student plan, but I want to talk about the graduate assistant health plan too. And there are two plan options. So very similar, you can see at the top there's a different website that's specific to the graduate assistants. For in-network, for a deductible, it's $0 for a graduate. If you see an out-of-network provider, it's going to be, your deductible is going to be $200 if you have an individual plan, so you're just covering yourself, or $600 for a family. For an office visit copay, it's going to be a $10 copay. But if you use Doctor on Demand, and that was that telehealth option that you have available to you, it's going to be a $5 copay with in-network. Okay. For out-of-network, you're going to need to meet that deductible. So let's say you're just covering yourself. So you're going to have to meet $200, and then you would pay 20% after that deductible. For your out-of-pocket maximum, keep in mind this is the maximum amount you would have to pay for a plan year. For an individual, it's $2,500 and $5,000 for family. And that's the same both if you went to using a provider in the Aware Network or if you were out of network. You'll see differences here now with in-network versus out-of-network. For preventative care, well child care, hospital care, it all covers 100%. Your plan pays 100% for in-network. And then if you go out-of-network, you're going to see some differences there. So for preventative care, so once again, those yearly physicals, you're going to pay 20% after your deductible is met. The well child care or hospital care, it's 100% of the allowed amount. And what that means is that out-of-network providers can charge whatever they want for a service, okay? And for in-network, they have that contracted rate with Blue Cross Blue Shield. So once again, your plan is only going to pay 100% of the allowed amount. So allowed amount just means that if the doctor charges something, let's say an allowed amount is 200, but the doctor charges 500, you'd be responsible for the additional charge that out-of-network provider has. For emergency room care for both in-network and out-of-network, it's going to be a straight fee of $40 copay. Next slide. This is going to be Plan 2. So this is for dependents only. You can see your deductible there. Same for in or out of network, $100 for an individual, $200 for family. And then your office copays, $25 copay or $10 copay for doctor on demand. The out-of-pocket maximum, so this is the same for in-network and out-of-network, is going to be $1,000 for an individual and $2,000 for a family. Very similar or identical, actually, compared to the other plans. If you go to an in-network provider for preventative care, it's going to cover at 100%. So you will have no fee, no cost. And for out-of-network, then there's still meeting that deductible for a preventative care, 10% after deductible. But for childcare, it pays 100% of the allowed amount. Emergency room care, $40 copay again for both in-network and out-of-network. And once again, I just want to remind you, Boynton Health, no cost to you. Next slide. And then we get into prescription drug coverage. Thank you. And for the student health benefits, the preferred type of medication, you're going to hear this, and this can be confusing. And once again, you don't have to be experts in this, and you're going to learn along the way. But a preferred generic is your least amount, for a medication, and you're going to have a $15 copay. Once you get to a preferred brand drug, then there's going to be a $25 copay. You will see, like for specialty drugs or non-preferred drugs, there's going to be no coverage. And the great thing here, I tell you, that doctors will work with you on what coverage, what medications that are available to you for preferred generic, for example. And Doris just added an important thing there for the Boynton Health pharmacist. That's a great number to keep and put in your phones if you do take medication, because they're going to be able to explain a lot to you too about the medications that you can get through them. Next slide. And the graduate plans, you do have a little bit different with your medication, with your prescription drug benefit. I'm just going to go through, well, no, actually, I want to go through the home delivery too. So I was going to say I was just going to go through the first column. But for preferred generic, once again, your least cost. For a retail pharmacy, it's going to be a $10 copay. And if you look, there is a 90-day prescription option. So then, and even home delivery, which I absolutely love, that you can get right delivered to your door, 90 days available of medication, and you would be a $20 copay for that. Now, once again, you see the changes with the cost once you get into a preferred drug or preferred brand, for 30-day supply at a retail pharmacy. And once again, you can find who your pharmacies are that are in network, that are part of the in-network plan on the website, or even when I was talking about Blue Advisor, right at your fingertips on your phone. And something different for the graduate plan is that you do have access to specialty drugs, along with the non-preferred, non-formulary drugs as well. We can go to the next slide. And next one, I'm going to just highlight some health and well-being resources for you. One is called Learn to Live. This is online behavioral health therapy. So think of that mental health support, just feeling stressed with all the changes that you're going to be experiencing. Sometimes it's nice having support out of people from our own age or our own friend group, or just when we're trying to meet people. So that's social anxiety. Sometimes just with your your class load, and the different classes you have, that can be stressful. But here is a direct website to Learn to Live. And one thing too, when I was talking about Doctor on Demand earlier, I mentioned it, but quickly, was that Doctor on Demand also does provide support for mental health for therapists or psychologists and psychiatrists. In case any pregnancies, there's a maternity management program where you're going to work with a maternity nurse at Blue Cross and get just one-on-one support during your entire pregnancy. And you can call Blue Cross to get that information if you happen to be pregnant. Another one too is for smoking, vaping, so any kind of tobacco use, especially during stressful times, that can even be more challenging to quit. But with Blue Cross, you have a wellness coach that can help you develop a plan that by quitting smoking or whatever, if it's vaping as well. And there's a number for you as well. And once again, you can access these plans. I just want you guys to know too that on your member ID card, you're going to see a number there, and you would be able to get to all these numbers, or all these different programs, these well-being resources, by just even calling that Blue Cross number as well. So if you remember these numbers, great. But don't be worried if you happen to not remember them all. Next slide. And here I just finish up with customer service at Blue Cross. It is 7 to 8 p.m. Monday through Friday. And then talked about the URL on the back of your member ID, but I'm going to add in another pitch for the Blue Care Advisor, that app where you can search for doctors and hospitals, any type of care that you need. And next slide. Okay, that's it. So I'm going to thank you so much, everyone, for letting me share those details. And once again, it's a lot, but you've got a great support to help you anytime you need. And I'm going to pass it on to the next presenter.
Thanks, Jill. That information is so important. It's so valuable, and I'm really glad that this session is being recorded. Hi, everybody. My name is Cody, he, him. I work in new student check-in, and I just have a quick reminder for you about new student requirements. International students must complete a checklist of requirements that's just for ISSS. We call it the New Global Gopher Required Tasks. You can see a picture of it here on the slide. This task list guides you through requirements you must complete and information you need to know as you prepare for your first semester. There's a section for things you do before you arrive, and another section for things you do post-arrival. To ensure that these tasks get done, ISSS will place a registration hold on your account on September 2nd if you have not completed the list. You will not be able to register for classes or change your registration after September 2nd until these tasks are complete. If you complete this list before September 2nd, no problem. It won't affect you. So my advice is to start right away. Be ahead of schedule, not behind. On the next slide, you can see one of the pre-arrival tasks, iPrep. It's the International Student Preparation course. It is separate from the orientation prep course. This one is just for international students. iPrep is an 8-part online course full of very useful information about visa regulations, academic culture, what to expect when you arrive, and more. It will take a few hours to do, so don't wait until the last minute. All right. I'm sure you all have questions, and I'm sure we have answers. So I will now pass it to Marina to start our Q&A portion.
Thank you, Cody, for reminding students about the requirements. Again, if you haven't attended any of the previous Go Gopher experiences, my name is Marina Uehara. I use she, her pronouns. And I'm the Director for Student Engagement in ISSS. And I, just like many of you behind the screen, I used to also be an international student. And I remember having a lot of questions around immunizations and healthcare and housing. So I am excited to start answering questions live right now. And so if you haven't already done so, as Liam mentioned earlier today, there's a Q&A function below. Please continue to submit your questions, but I will be inviting our panelists to come back and answer questions for us today. So I do have one question that is on the Q&A function. And that question that was also submitted earlier for Greg is, when does coverage start? So if a student arrives here a little bit before the semester start, what is the actual day that the insurance actually kicks in? So Greg.
Yeah, that's a really good question. And the short answer is you're covered from the moment you get into the United States. So nothing to worry about with that. You're covered from the moment you get into the United States. So if something were to happen, your claims would be covered under the terms of the plan document. Now, the reality is, of course, that it takes some time to get information over to Blue Cross in order to have your record show on their site, so that, when you talk about the app that Jill talked about, the app that you could get and those kinds of things. I think that from what it looks like, it would probably be about August 25th, August 26th, when the information would be showing on Blue Cross's website. But again, if you're coming to the United States August 12th or whatever the case is, you'd have coverage from that point forward. Now, the key is, if you need if you need services provided anytime before you get your ID card, then contact the Office of Student Health Benefits, and we will walk through making sure that you're set up at Blue Cross so that you can get the services that you need.
Okay, thanks, Greg. It sounds like if students need immediate care, make sure you connect with Greg's team. Otherwise, students are covered, but it's, you also want to have that card. And so if you can wait till August 25th, 26th, you'll have to do less paperwork, it sounds like.
Yep.
Okay. A lot of you have also asked during your registration, what does our student health insurance cover, and how can I utilize the U.S. healthcare system? Of course, the whole presentation addressed that, so hopefully we were able to answer those questions, although we don't expect you to remember all of this. So make sure you download the resources and the apps mentioned, and continue to reach out to folks if you have specific questions as well. There is a question around specifically around gender affirming care. So I was hoping maybe Gracie could come on board and just reiterate some of the services that Boynton has regarding specifically resources for our trans and queer gender affirming care. If Gracie would be able to pop up again on screen.
Hi, thanks, Marina. Yeah, I'd be happy to talk about our gender care services. We have a variety of services at Boynton's Gender Care Clinic, including but not limited to hormone replacement therapy, or HRT, preoperative exams, referrals, and support for gender affirming services, surgeries, fertility preservation, and much more, gynecological care, primary care, We also offer pre-exposure prophylaxis, which is known as PrEP, a medication designed to prevent HIV. I can send the link to our website in the chat. Oh, I see it's already there. Yeah, if you have specific questions about care, I would recommend emailing BH-QUEST or calling our phone line directly, and they can help answer specific questions about care.
Okay, thanks, Gracie. And I know there's a lot of resources available at Boynton, so bh-quest@umn.edu will be your best email and point of contact for all of our students. I'd like to switch over to maybe housing-related questions, and I'll prep Katie to come back on our stage. But we have a question around temporary accommodations being available around August 18th to September 1st, and if there are any arrival housing options for international students.
Hi, yes, thank you. So yes, you can stay with us starting on anytime now in August. Unfortunately, August 28th, which is a Friday, unless you are a fall resident in one of our on-campus housing buildings, August 28th is the checkout date. And it will be at 4:30 p.m. But we do have resources available to assist you for that gap period, or if you still are looking for housing, we do still have space available on campus or in our co-op. So there are options still available if you're looking for a housing lease or agreement. Otherwise, again, we can help provide some temporary housing solutions between that August 28th and the 1st of September.
Okay, thanks, Katie. And I know you and I work together closely to have programming as well for international early arrival housing residents. And so the team here today will also be hosting Global Gopher Tea Time on Thursdays from 1:30 to 2:30 p.m. So you can definitely meet the student leaders in person. So Katie, I know that another student had also asked about, what if I arrive later at night? Can I check in later at night? Is that an option? And something around the moving options are from 8 a.m. to 8 p.m. Would you be able to reiterate that response to this audience?
Yeah, certainly. So our desk, so within every building that we have for on-campus housing, we have an information desk. And so if you are coming for international early arrival housing prior to August 25th and you are not living with us, you're going to go to Centennial Hall. And that desk is open 24 hours a day. So all of our desks are open 24 hours a day. You can arrive at any time. If you are looking for that fall move-in time and the 8 a.m. to 8 p.m. time frame does not fit with your flight schedule, you can certainly just pick any of those times and then arrive when you get here. That is totally fine. The desks will be open and available to assist you to check in at any time within the day, and evening.
Okay. And if a student is running late, is that okay if they've already scheduled the time to move in?
Yeah, absolutely.
Okay, thank you for that. And one more question, Katie, for you.
Yeah.
Are dorms and residence halls open during break?
So we do have some buildings that are, but not every building. And so you will want to look at, we will send a lot of communications but all of our website will indicate which buildings are open during break. The apartments, so UDOF and Keeler absolutely will be open. And then we do have other options that are open. If you are a fall resident in a building that is not a break housing building, we do have temporary spaces in those break housing options for you to move into a temporary space if you need to stay on campus throughout the break. So there are options for all residents.
Thank you, Katie.
Yeah.
I think this wraps up most of our housing questions. So I'll be inviting Greg and Jill to be addressing some of the insurance and student health benefits questions as well. One of them is a medical record transfer. Should we transfer our medical records from our home countries?
I don't know that I can really advise on that. I guess I would say it probably one of the factors may be, kind of what your medical history is. Obviously, if you have some chronic major issue, it might make sense to do that. But I would probably defer to a Boynton provider for that.
Okay. I believe like in the past it's only if like if the provider has specifically requested for them, or if you have ongoing care. We've had students that were diabetic and they had to transfer that care to a Boynton provider. And so we always recommend students to reach out to Boynton and figure out the best way to have that continued care and not be interrupted as you come here as a new student. Jill, I have a question for you regarding the app, the Blue Cross Shield app. The student is asking, I assume we sign up with our U of M email. Is that correct? And how early can a new student sign up for the app?
Yes. And so let me tell you this. So if it's before, like when you just got here, like Greg had said, you're going to receive care, contact the student health benefits. But when it comes to the app, you do need to have your member ID number. And if it's before we have your information from the university, it's going to be blank. So it's something to wait until, Greg, did you say the official date? Was it August
here's
24th?
It's unfortunately, I wouldn't say there's a one size fits all answer on this.
Yes.
Now, in the case of the student health benefit plan, there'll be a file that goes over on August 24th that I would think would be loaded and everything would be showing and available for, August 25th, August 26th. The issue with the graduate assistant health plan, remember that to enroll in the graduate assistant health plan, you have to submit your enrollment form, a paper enrollment form, to the Office of Student Health Benefits. And then we have to process that form and get it over. So it's not going to be, there's not any specific day where I can say with absolute certainty what it would be for the graduate assistant health plan.
So what we're noticing from all the questions is that the questions seem pretty straightforward, but the responses seem to be a lot complicated because it really depends on your specific situation as well. So again, I'm going to say this 1,000 times, but we do encourage you to reach out to the respective offices and units here to really ask your specialized question, because it really depends upon your unique situation as well, and want to be able to give you appropriate and accurate responses. I do have additional questions around financial assistance for students who struggle to pay medical bills. Greg, would you be able to maybe share some of the university resources as well?
I'm sorry, Marina, I'm not real sure about that. I know that there is some emergency assistance potentially available, but that's not really limited or focused specifically on medical expenses. And I don't know that, I'm not real sure what the resources are for that. It's
Okay. Yep. No, that's perfectly fine. I think at the last webinar you had mentioned One Stop being able to have some student emergency funds, and then ISSS also has an ISSS emergency fund for really some of these unplanned emergency costs as well. So as always, we encourage you to reach out to ISSS if you have any additional questions. And then one additional question for you, Greg, regarding university offering family health insurance. If someone has a baby, for example, what does the dependent coverage look like?
Sure. The dependent coverage would be the same. There's an additional charge if you're bringing a dependent on. It's in the student health benefit plan. It's basically the same cost for a dependent, same additional cost for a dependent as for the student. On the graduate assistant plan, the university would pay essentially 85% of the cost of your dependents.
Okay, thank you, Greg, for that. I also see quite a few questions around housing. I do encourage you all to reach out to housing directly, especially if it's related to your specific assignment. Let me see. There is a question on the chat talking about applying for on-campus graduate housing that starts on June 17th and still waiting for room assignment. Katie, I was hoping you would be able to come back to answer this question. What should I do next to be assigned, as I am worried because I am arriving on August 28th?
Sure. So if you have not received your assignment yet, they are still working and sending communications out. So don't worry. You can always check the status in your housing portal. And if you do have specific questions to your situation, certainly please do reach out to housing via the Contact Us webpage, which I can make sure to put in the chat as well.
Okay, thanks, Katie.
Yeah.
I also see a question around it's not specific about housing, but the question is it fine to come into the dorm or the resident hall after the semester has started? And so for this particular student, if you're asking about being able to arrive to the University of Minnesota after the mandatory arrival date, please email issnew@umn.edu because there are, you may not be able to arrive late depending on what date you're asking. However, if you're asking to be able to check in after the semester has started, I believe that's okay, right, Katie?
Yes, as long as, and we'll send communications out as well, if you have not checked in yet. But if you know that you're coming late, that's also helpful. If you can just email us and let us know, we can put a note in so that we can expect your arrival later.
Thanks, Katie. Well, it is almost, it's 9:17, so we want to make sure that we get all of your questions. But right now I'm going to be asking some of our students to also be sharing their experiences with the U.S. healthcare and any other advice that they have. So the question for our student team is, what was your experience with healthcare in the U.S.? Can you share a little bit what that experience was like?
I think I can go first.
Okay, thanks,
So,
Doris.
this summer I just got a cold, but I have to get onto my plan. So to make sure about like everything went well with myself and with my plan, the other people, I just go to Boynton directly. And they are like all really nice staff. They provide really good services. They help me to do a test for COVID, for flu. And you don't have to worry about anything. They cover everything. They provide additional resources for you, like if you are not feeling well, what else you can buy, what else medicine you can get. So, if you have any questions, you can directly go to Boyton or you can email them or just check their website. I believe that they are always really super nice and super welcome for any questions and any request.
Thank you, Doris. And I do have one more question for maybe another one of our student leaders. Is there advice you would give to new students about how to stay healthy and well? Any resources that you would be able to recommend to our incoming new students?
I can answer that question. I
Thank
think
you.
my biggest advice would be to get regular mental health checkups with Boynton. One of the things I regretted is not starting as soon as I got here. I only started about a year ago, and it's been just so worth it to just regularly speak to somebody, and it's all covered. So you really have to, you really have to take advantage of that resource. And yeah, it's super supportive, especially um, after going through my first winter. Definitely I was not used to the weather and just the change of environment. So I'd say you got one thing you want to utilize is the is Boynton's mental health department.
Thanks, Liam. And I know from my friends from the mental health clinic that they always recommend that you start seeing someone before you actually need to see someone so you can establish that care much earlier. Because a lot of our students, if not the vast majority of our students, actually go use our mental health clinic and services. So I believe there's we are wrapping up with our questions. I don't see any more live questions being submitted. So I want to say thanks to our presenters today, to Katie from Housing, Greg from the Office of Student Health Benefits. I know that Gracie and April from Boynton Health were also answering quite a bit of questions as well. And then Jill from Blue Cross and Blue Shield, as well as all of our ISSS staff that are here today answering questions for you. Again, I encourage you to continue reaching out to us and asking the questions via email. And I'm going to pass it off now to do the wrap up for our session today.
Thanks so much, Marina. And thanks so much for that very informative Q&A session. And thanks so much, everyone, for sending in those questions. And I should acknowledge that health and wellness is not the easiest thing to figure out as you move into a new country, especially to the US. And it's understandable that you have so many questions, so many doubts. So I will tell you how to stay connected with ISS. So if you have questions with regard to health and wellness or with regard to anything, please reach out. Do not hesitate to reach out, ask questions. And this is how you stay connected with ISS. There are many ways to stay connected with ISSS as a new international student, including the new student website in ISS as at umn.edu. And a link to this website will be shared in the chat, and our Global Gopher Experiences website as well. And you can also contact us at issnew@umn.edu via email, and this will also be shared in the chat. And when you reach out to this email, an ISSS staff member will respond to you. So as an international student, it is never wrong to ask, to reach out, to connect. So always feel free to reach out and connect with ISSS. So once again, welcome to our Global Gopher family. And make sure you also, don't forget, make sure you also follow our social media platforms as well. And before we wrap up, I want to tell you a bit about our next event. So if you could go to the next slide, please. So our next event for fall is Meet Your College Fellows, and it happens on August 19th from 8 a.m. to 9:30 a.m. Central Time. And if you're interested in connecting with all your college, with your college, and this is a session where you can meet your college advisors, graduate program coordinators, and coordinators from professional schools, and connect with other new international students like you and in breakout rooms. Please do not miss this opportunity and make sure you register in advance. So once again, thanks so much for joining our webinar today, Health and Wellness webinar. It was a lot of information, and I know it takes time to figure out the health insurance and everything with regard to health. And we have recorded this session, and we will make sure that recording is available to you. So before we end our session today, we will be playing a Goldie video, and this whole video will be 4 minutes long. So I encourage you to stick with us if you would like, and we will see you in the next webinar. And we also look forward to welcoming you in person in a few weeks. So thanks so much, everyone, and see you soon.
I got this feeling inside my bones. It goes electric wavy when I turn it on. Off from my city, off from my home. We're flying up, no ceiling when we in our zone. I got that sunshine in my pocket, got that good soul in my feet. I feel that hot blood in my body when it drops. Ooh, I can't take my eyes off of it, moving so phenomenally. You're more like the way we rock it, so don't stop. And under the lights, when everything goes, nowhere to hide when I'm getting you close. When we move, well, you already know. when you dance, dance, dance. Feel good, good creeping up on you, so just dance, dance, dance. Come on, all those things I shouldn't do, but you dance, dance, dance. And ain't nobody leaving soon, so keep dancing. I can't stop the feeling, so just dance, dance, dance. So just dance, dance, dance. Come on. Ooh, it's something magical. It's in the air, it's in my blood, it's rushing on. I don't need no reason, don't need control. I fly so high, no ceiling when I'm in my zone. Cause I got that sunshine in my pocket, got that good soul in my feet. I feel that hot blood in my body when it drops. Ooh, I can't take my eyes off of it, moving so phenomenally. You're more like the way we rock it, so don't stop, stop, stop. Under the lights when everything goes, nowhere to hide when I'm getting you close. When we move where you already know, so just imagine. Nothing I can see but you when you dance, dance, dance. Feel good, good creeping up on you, so just dance, dance, dance. Come on, all those things I shouldn't do, but you dance, dance, dance. And ain't nobody leaving soon, so keep dancing. I can't stop the feeling, so just dance, dance, dance. So just dance, dance, dance. So just dance, dance, dance. I can't stop the feeling, yeah. So keep dancing. Oh, yeah, yeah. I can't stop the. 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 Nothing I can see but you when you dance, dance, dance. Feel good, good creeping up on you, so just dance, dance, dance. Come on, all those things I shouldn't do, but you dance, dance, dance. Ain't nobody leaving soon, so keep dancing. Everybody say. I can't stop the feeling. Oh, no, I can't stop the feeling. I can't stop the feeling in my body. Break it down. Got this feeling in my body. Can't stop the feeling. Got this feeling in my body. Come on.
Thanks so much, everyone. See you at the next webinar. Take care.